scenario discusses the condition which is called as Piebaldism, in which impaired migration of the melanocytes is classically the reason. So answer is going to be option D, and the diagnosis is Piebaldism. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack DrMSD. So this case scenario is discussing about the presence of the white forelock, which is also called as poliosis, with a patch of depigmented skin. It is classically seen in Piebaldism. Or also there is a syndrome called as Waardenburg syndrome, in which we are going to see, along with the white forelock, the presence of the sensory neural hearing loss, heterochromia iridis can also be present. And basically the melanocytes which come from the neural crest, they are going to be impaired migration of these melanocytes, because of which they are not going to reach the skin surface. So there is going to be this depigmented skin lesions. Autoimmune destruction of the melanocytes is very classically seen in vitiligo, in which it is a acquired disease but not congenital. Remember, defective phagolysosome fusion is seen in the syndrome which is called as Shediac-Higashi syndrome, in which patients can have albinism, recurrent infections, neurologic defects, and also giant granules can be found in the leukocytes. Tyrosinase enzyme defect is going to produce albinism, in which the patient's skin is going to have the melanocytes, but because rate limiting enzyme is defective, so melanin production will not happen, because of which hypopigmentation is going to be present in a diffuse fashion involving skin, hair, and the eyes.